Hey everybody, Dr. J here again, and today we're going to be looking at a case of scoliosis. Now, most of us are familiar with that term. That means there's a significant amount of curvature in the spine, but I bet most of you have never seen what a scoliosis looks like on an x-ray. Let alone, I'm sure a very, very small percentage of you have ever seen what it looks like when somebody's had a surgery that is done with rods up and down the spine to try and keep that scoliosis from getting worse. So that's what we're going to be looking at today. We've got a case with a patient named Barbara who came in with upper back and neck problems, neck pain, as well as low back pain. We're going to show you how chiropractically we can still work with people that have had that type of fusion. So stay tuned. All right, so again, this is Barbara's films, and we're going to have a conversation with Barbara and find out from her in just a minute what's been going on with her. But again, this is what scoliosis looks like. And again, a scoliosis is a significant amount of curvature in the spine. So if you can follow my fingers here, this is the curvature that's in her spine. Now, when Barbara was 18 or 19 years old, they put these rods up and down from basically almost the base of her neck all the way down to the bottom of her spine to try and keep that scoliosis, to try and keep that curvature from getting worse. And so when Barbara came into her office, she was dealing with upper back and neck pain and tightness, as well as lower back pain. But we're able to work with her chiropractically. And the reason for that is because where her nerve pressure is, and you'll see this in a little bit with my instrument, but her nerve pressure was above where the surgery is up here, and then also her problem was below the surgery over here. And so the problem in her low back was down in her hips. So again, as you can see over here, the surgery goes all the way down. This is her fifth lumbar. It stops right about there, actually goes into a little bit of her sacrum, that bone between your hips, and then it goes all the way to the top to her third thoracic. Well, where I was adjusting is at her second thoracic, again, just above that surgery, and then her hips. So it does not affect that surgery at all. And so she's still able to get great results even with this type of fusion surgery that she's had. So I'm here with Barbara, and Barbara came to our office. She was dealing with some neck pain as well as low back pain. Now, in your situation, this has been going on for quite a while, right?
For years, and I had my accident.
You had an auto accident back in the early 80s. So before you came in, I believe you were dealing with daily tightness and stiffness in your neck as well as your low back. Tell me about your neck. Has there been any change with your neck?
My neck is perfect. Even now I can very sleepy, because sometimes you say, I cannot sleeping. It's because my age, I'm getting old, and that's not the problem. So the problem is sometimes you have pain, and the pain obviously obstructing your sleeping day.
So you're sleeping better, less pain, and sleeping better.
Sleeping better, and then also before I take Excedrin the other day because I don't like pills, and then now I don't take nothing, and then
you're not taking anything anymore.
No, I don't.
Oh, that's awesome.
Not take anything because I'm not a person for pills.
Yeah.
Just if I have necessary to take a pills, I will. But the other ways, I don't.
Yeah.
And then also when I'm walking in my lower back, that was really painful before, and now I can be able to handle more walk, and then doing more activities, like you clean your home, and then in pain no more.
Yeah.
So I think it's a great technique what he used, and then also he helped me a lot. So I really appreciate it.
Yeah.
So.
Well, fantastic. Well, I tell you what we're going to do next is we're going to get you adjusted, and we're going to use that instrument to find where the nerve pressure is coming from, and we're going to get you adjusted, and we're going to show people what that looks like for somebody that has a condition like yours and those Harrington rods that have been put in your spine. So what this instrument does is it detects heat. It compares the temperature on the surface of the skin from one side to the other. If there's pressure on a nerve, it will give off heat. And so ultimately what this does is this helps us to find where the nerve pressure is coming from. So what I'm looking for is for this needle to quickly jump back and forth from one side to the other. And because we've been working with her for a while, there's a lot less nerve pressure than there used to be. But you can see, especially right here, there's some nerve pressure right there. So what I do is I put a mark right there, and that tells me where we need to check. Now again, where that nerve pressure is coming from is above where she had her surgery. So we're able to adjust her, which is great. So again, I've got my adjusting hand placed in that spot, her second thoracic, which is above where that surgery was. So we're not going to interrupt those rods that are in the spine. Now we're just going to go nice and easy. place a little bit more pressure. I'm going to give it a little bump, and there we go. That moved very nice. That's exactly what we're looking for. Didn't take a whole lot of force, but we got the job done. So next what we're going to do is we already checked through the mid-back, and now I'm checking down in her low back. And where I find that nerve pressure, if you can kind of come in closer there and get that, you see right where this needle moves, just like that. That's where the nerve pressure is coming from. So let's see right there, where it quickly jumps. And so I put a little mark there, and that's where we need to check. Now again, the good thing is that's below where the surgery was. There's where the scar is, and we're actually below that. So that tells me that we can still work with that, and we have. And she's done fantastic, because where her problem is down in her hips. So she's been doing fantastic because we were able to adjust where the problem was coming from, which is her hips, below where that surgery was. So I just want to show you what it looks like from this angle. Again, I found her hip joint right here. I'm going to put some pressure on there. I'm going to give it a thrust here. Again, we're trying to correct that misalignment in her hips. There we go. Okay, so she's gotten adjusted, and now I'm going to check to see if that hip is moving better. Put my hand right on between those joints down in her low back, between her right hip and her tailbone. I'm going to bend her over to the right, and as I do that, I can feel more motion in there. So that's what we're looking for. We're getting that joint to function better, to move better, and with that, that tells me that we're working towards getting more pressure off the nerve. So that's exactly what we're looking for.